Hello everybody, I am Dr. Reena Kaul Mattoofrom Kanpur. As you all know, in IVF the most important step is ovarian stimulation, and for that we need some injectable drugs which are used mostly, and I'll be telling something about them. So the most common one used is HMG, as you all know, and HMG is available in either urinary form or highly purified form. Urinaries we usually don't prefer. The highly purified forms are available in 2 or 3 types, like we have a single dose vial, or we have a multi-dose vial, or we have pre-filled syringes. So pre-filled syringes will be something like this, and they are very convenient for the patient because they are already loaded. And in the multi-dose vial, the advantage is that it can be economic for a poor patient. And
speak towards the camera.
Okay.
Camera is next side.
Okay.
Show to her.
We'll do it again.
No. Cut.
Okay. Then we have the recombinant FSH. Okay. Recombinant FSH is also we have it in the form of either pre-filled syringes. The syringes like this. And we have it in the form of cartridges, or which we also call as pens. They are very convenient, and for these cartridges we have needles like this available, which can be changed every time, and they are very thin and patient friendly. Even the patient's husband or patient themselves can be trained to use these, and we also have a multi-dose vial for these. After that we next come to the HCG. HCG we have in urinary form and highly purified form. Urinary we prefer less. Highly purified is better because of lesser side effects, and we have them in mostly available in 3 strengths: the 2000, 5000 and 10,000. We also have a recombinant FSH which is 6000 and 500. Then we have the antagonist, commonly used as cetrorelix, and we have them in the form of a pre-filled syringe. Again, the pre-filled syringes are very convenient to use, and we also have them in the form of lyophilized powder, or sometimes we have them in liquid forms also. Thank you.
Recombinant HCG is what dose? What is the preparation? Recombinant HCG.
6,000 or 250 micrograms. 50 micrograms.
Always comes as a pre-filled
Pre-filled.
Next question for
Ma'am, which one do you usually prefer?
name and mine.
I'm Dr. Supriya from Punjab. I want to ask ma'am, which one HCG do you prefer for triggers usually?
Well, I use both. It will depend upon the cost factor also. So both are good. The highly purified one also, and the recombinant
Any
one
special
also.
cases where you can only use recombinant?
Well, recombinant FSH people prefer
HCG, trigger.
HCG trigger in dual triggers.
So any benefit in case of recombinant HCG, do we have lesser OHSs with recombinant compared to the
Yes,
conventional
it is said that the recombinant ones have lesser chances of OHSs as compared to the highly
one?
purified
And any
ones.
difference in the half-life of both the preparations?
Half-life, no difference.
See, in
Thank you.
10,000, we use 65 and that's the purity. So when we use the urinary HCG, we can't be sure because NH component may go up and down. But with recombinant one, we know that we got a fixed concentration. Otherwise, protein unit will actually be the same. But we don't trigger with 5,000, we trigger with 10,000. And when we use recombinant, it's in midway. 65 when we use a pre-filled syringe. And then the big difference is that when we go to trigger with HCG, we normally get HCG in powder form. So reconstitution is always a problem.
Tedious.
Because the nurse in the night at 2 o'clock or somebody can reconstitute, they may drop something, some powder may be left. Triggers are taken in the night. So triggers will take in the night, half the time, around 10 o'clock. So we may leave the powder behind. It can happen. So with a pre-filled syringe, we are very, very sure that we just put it in and inject. And we inject the right volume and right syringe. That's the main advantage of using a pre-filled syringe of recombinant.
Some powders like the cetrorelics can be very difficult to reconstitute. So pre-filled syringes, as sir has rightly said, are always better and convenient.
And sir, recombinant HCG also used when LH is less than 15 after first
Yeah,
treatment.
that's okay. Once failure of a record trigger, you have to give HCG. That's a very good option to give something like about, it's a recombinant HCG, which is 250 micrograms. You can use